Nurses of psych wards. What did a patient do that left you speechless? Story 1. This was actually in a state hospital that is part of the prison system for mentally ill offenders. The patient asked for Vaseline, which is fine. They can have Vaseline whatever. But this patient was given a whole tub, so of course, he stripped completely unclothed, covered himself in Vaseline, and ran. It was a secure unit, and he didn't escape, but we couldn't get him back into his cell all shift because he was too slippery. No more tubs. Story 2. How about in an inpatient addiction clinic? The first one that comes to mind was something I witnessed between a patient and another floor tech. We had a man who was in serious detox. The drug of choice was meth. He was throwing a huge tantrum. Not uncommon in DTs, people will do just about anything to get a fix. We weren't a locked facility, so it wasn't like he was stuck there. He genuinely wanted help. That's why he stuck around. And we were there to listen and help him through the shakes, hallucinations, and other symptoms. He was slamming his fists on the desk at this point, and he had started just yelling, "I just want some freaking ice." Well, the tech with me was inexperienced, although much older than me, and while I talked to him and tried to calm him down, she went back to our staff kitchen and got him a glass of ice, like frozen water. She brought it out to him and put it in his hand like problem solved, and the guys just froze with confusion, staring at it. The patient and I both realized at the same time she thought he wanted ice, and we just stared at each other and started laughing. He was in for a rough couple of days, but I've never seen someone jump from a near psychotic episode to giggling so fast. Story 3. I was a CNA for about 4 years, and the saddest ever was my client/resident constantly thought I was her daughter. She went to Harvard and was an extremely brilliant lady in her time. She was nonverbal, but every time I walked into her room, she would exclaim, "Elizabeth, you came." I loved this lady so much, she would only eat when I fed her. She was extremely combative with everyone but me. I ended up quitting my job there but visited her every single day, to the point that her family kind of accepted me as their family. I finally found out that Elizabeth took her own life at 21, and the fact that she thought I was her gave her extreme joy. I never corrected her, and I like to think I gave her peace when she passed holding my hand. She was an amazing lady, and I miss her to this day. Story 4. When I was in nursing school, I had a clinical in the state-funded psych ward downtown. I was assigned to sit with this one girl to monitor her behavior. She spent about 30 minutes doing nothing but eating pudding cups with a plastic spoon. She ate like 6 of them in half an hour. Then out of nowhere, she very calmly licked her spoon completely clean and pulled her shirt sleeve up before shoving the entire spoon into an incision in her arm near her bicep. Then very calmly said, "Oops." The nurses that worked there didn't believe me. They kept saying I was making it up and that I couldn't have seen what I saw. Only later on, like 4 hours later, it was a 12-hour clinical, did the girl notice the girl had some blood on her shirt. He took her into her room to change her clothes and noticed that an incision on her arm had developed and had been bleeding, then eventually agreed to send her to the hospital for testing. The X-ray showed the entire spoon, sucked into the fat of her upper arm, through an incision where they'd removed a birth control implant in the week before. Apparently, the girl had slowly been picking at the sutures and opening it bit by bit until it was deep enough to fit an entire plastic spoon. The girl admitted that the OHOPS was because it had gotten sucked in and couldn't be pulled out, not because she stuck a spoon in her arm. Totally bizarre. Story 5. We had an older black lady who would walk up and down the ward constantly mumbling. It never stopped. I think she would get something like Thorazine to calm her down, but she would fight it and her eyes would be all droopy, and she'd slow down, but she kept going. Nobody understood a word she said, and she was there for at least over 6 months. She was punched once by a patient while he was on the phone because she kept walking by ranting. He just lost it. Anyway, I'm up there doing a patrol one day. I was security, and she's panting and walking up and down the ward as usual, and they call her to come get her meal. She sits down and opens her tray and stops ranting and states, clear as day, "I didn't order no diabetic tray cow." Every last person turned to her and all of our mouths were wide open. That was the only thing she ever said clearly. Story 6. Years ago, I was a student nurse doing my psych rotation in a Catholic facility. The nuns still wore habits, and the building was like something out of the Dark Ages. I'll skip talking about the line of patients waiting to undergo ECT treatment in the basement and instead tell you about Maggie. She was a tragic case. She had been on lithium for years, and it really kept her psychotic episodes in check until they reached toxic levels and could no longer take it. One hot summer afternoon, we heard this banshee screaming coming from Maggie's room. We rushed in there to see what was going on. Entering the room, we are greeted by a scene I will never forget. This late 70s woman is standing on the window ledge, unclothed as a jaybird, screaming through the window screens at the nuns in the courtyard. "You freaking penguins are going to burn in hell." The poor sisters are scrambling to and fro, trying to get away from the ranting madwoman's viscous verbal assault as we were trying desperately to pull her off the grating. I knew then and there that I would never become a psych nurse. Story 7 had a catatonic guy who could play the piano like a pro, classic, jazz, ragtime, but otherwise just sat in his chair and stared. I played a show once with a trumpet player who was also a home administrator for a facility that specializes in memory care. He told me about one of their patients who had been a professional musician in his earlier days. He was always playing the piano, but he only remembered one song, Darktown Strutter's Ball. The staff had tried everything to keep him from constantly playing the same song endlessly, but couldn't come up with an effective way to keep him from playing the song. He would bust the piano open if they locked it. He would find it if they hid it. Eventually, the administrator happened to be on that floor when the pianist was looking for his instrument and saw the behavior and the agitation it caused when he couldn't find it, and he said, "What are you doing? It's break time. Don't play through your break. Go over to the bar and get a drink." That satisfied the pianist and helped him to understand that he didn't need to play the piano at that moment. Story 8. Not a nurse or pharmacist. One of our clozapine patients misses a monthly meeting to discuss their medication, called around, and found out she was in the ICU having eaten 2 of her own fingers, then visited her mother for coffee, still bleeding. A friend told me of another patient who made a cut in his thigh and reopened it regularly until the whole thing was a scar tissue cavern, by some miracle avoiding infection. Started using his meat pocket to hold pens and coins and anything he could collect in his ward. Nobody knew until a paper clip pierced the side, and he finally wound up with an infection that took him to the ICU where they found his stash. Story 9. Obligatory, not me, but my former best friend told me the story. She wasn't a nurse, but did an internship at a psych ward for adults, and part of her internship was supervising the adults outside in the garden, making sure they didn't harm themselves or others or run away, and talking to them. She and about 5 patients were outside on a beautiful summer day, each relaxing and smoking in silence, basically just chilling like fully functioning adults, until one woman, about her early 70s, no Alzheimer's or something, took her chair, pulled it right next to my friend, stepped on it, clumsily climbed the stone wall surrounding the small outside area, and yelled, "Bye, witches," and ran away. My friend and the others just sat there, staring after her, not being able to believe what they'd just seen. She was found 15 minutes later, just wandering through the city looking for booze. I just can't laugh at the thought of this granny climbing the wall and yelling, "Bye, witches," while fastly waddling away. Story 10. I'm an RN in Boston in a psych hospital, and I've seen some crap. One of the things I'll never ever forget was we had this manic guy who had been transferred from another unit because he kept getting in fights over there, and all the other patients were trying to attack him. I was still working nights back then, and at about 3 a.m. he came up to me and said his tooth hurt and he needed to see a dentist right away. I said I don't have a dentist for him to see, but when the doctor comes in the morning, we can take a look. Gave him some Tylenol and sent him back to bed. About 5 minutes later, he came out saying it really hurt and he needed to see a dentist to pull his tooth. Again, I told him, there's no dentist, but maybe I can get some more pain meds. In the middle of me explaining this to him, he sticks his hand in his mouth, rips his molar out of his head and hands it to me. Blood started pouring out of his mouth, but he did even seem to notice. After I clean him up, get the bleeding to stop and call the doctor to get him some Ativan, he goes, "Make sure you give me that tooth back when I leave. That's my tooth, don't try and steal it." Wild. Story 11. Probably the saddest was a resident I had a long time ago. This gentleman was a World War II vet with Alzheimer's and dementia. Probably once or twice a month he would relive some battle he was in. He would literally run up the hallway and grab you and yell at you to get down behind the sandbags. He would then tell you to take his Thompson. Because it was too heavy for him, he would just use his pistol. Then he would get up and run back down the hallway. This guy was old, and seeing him run full sprint like that up and down the hallway during one of his episodes was surreal. I can't imagine having to constantly relive the worst moments of your life when you witnessed and survived the unspeakable horrors of war. Story 12. My sister was actually sectioned earlier this year for her eating disorder. She shouldn't have been, but that's a story for another time, and she was right next to the psychiatric intensive care unit. One of the nights she heard multiple screams coming specifically from that ward. One of the patients had bit a chunk out of a nurse's leg as they were trying to detain them. They then started eating said chunk. It's crazy to think these types of things happen. Story 13. Not a nurse, but I was a patient in a psych ward. The ward was sectioned into two sides based on case severity. I was on the less severe side. One night, an incredibly tall, somewhat muscular man escaped his room on the severe side, got through a door that was supposed to be locked, got into the less severe side, and into my room. I woke up, sat up, and saw him standing in my doorway. He asked in a shaky voice if I was all right. I hesitantly said yes, to which he responded by getting a look of terrified horror and screamed, "I knew it! You can see them too. Don't let them get you," before he was dragged away, screaming by security. Story 14. I've posted about some of these before, but here goes. I'm not a psychologist but a former mental hospital patient. I'm depressed but was in a closed psychiatric facility on 2 occasions. Once this was because I had myself committed because I was suicidal, and once because there wasn't any space in any other kind of clinic. My roommate watched me brush my teeth on one occasion. While I'm doing this, I realize that he's staring at me. I try to ignore it. Then I realize he's staring at my toothbrush. He then tells me, "You shouldn't stick your lightsaber in your mouth." Okay then. There was a former soldier with PTSD who shared a room with me for a few days. I slept with earplugs during this time because he snored, so I only heard this story from fellow patients, and I'm not sure it wasn't exaggerated, but something close to it must have happened, because I did see the destruction afterward. A guy with PTSD can't sleep, so he goes to the duty nurse for sleep meds. The duty nurse at the time was a major a-hole, not because she wouldn't give you meds if you asked. After all, she's more qualified than you to decide whether you should be given something or not, but because she treated you like an 8-year-old when you did ask. And not everyone in that facility had the mental faculties of an 8-year-old. Thank you very much. Anyways, she tells him that he can't have sleeping meds and that he should try and sleep without them first. So the guy starts pacing up and down in the hallway. She comes and tells him that he needs to go to sleep and that he's disturbing other patients, but he ignores her. She grabs him by the arm, and the guy completely flips, breaks the nurse's arm, and tosses her into a wall, beats up 2 more hospital staff and 2 policemen that the hospital staff called to the scene. Then the head doctor of the station gets called in. He was off shift when this happened. Goes up to the guy, tells him something about having a drink with an old comrade, and gives the guy one of those plastic medicine things that look like shot glasses with a massive dose of diazepam or some such. He drinks it and eventually keels over. Again, don't know if it actually went down like this, but I do know the nurse with the broken arm was fired for mistreatment of patients, and the hallway looked like it had been the site of a serious fight. The staff was cleaning bloodstains the next morning. The handrails had been ripped out of the wall, and another piece of drywall somewhere looked like someone had been thrown through it. I slept through the whole thing thanks to earplugs. Story 15. Got assigned to a child's psych ward in a hospital where I worked. An easy gig. Wear street clothes. Not much to do, but pass out meds and observe. A 15-year-old black kid, overweight, is sitting beside me, casually discussing his day when he jumps up, begins screaming like a banshee, flailing around, and looks like a seizure on steroids, and I'm befuddled as to how to control him or the situation. After a few minutes of twisting my nerves into a tight ball, he stops, sits back down, and begins talking casually again. Had one of his spells. Not sure if anyone has ever been that close to a raving maniac while he's having a fit, but it's disarming, to say the least. Story 16. A nursing student here is also not my story. A friend of mine is a nurse in a psychiatric hospital. Some context, some of the patients were outside sitting on the benches and walking around, and she was walking with some other patients. There was a patient standing by a door. Dude was like 200 kilograms, 450 pounds. Actual story. A skinny guy was smoking and just minding his own business when out of the blue he started running and just spears the 200 kilograms guy into the door like a steel and glass door, and then just walked out of there like he did nothing. The big dude got a broken skull, a dislocated shoulder, and some minor injuries. The skinny dude got nothing. I don't know what triggered the dude to throw himself at a dude 3 times larger than him. Story 17. My ex's mom used to work at Broadmoor Hospital for years. For those unaware, Broadmoor is a very famous asylum for the criminally insane in the UK. She said the strangest thing was how normal the patients were because of all the meds they were on. They're like children eager to please. She met Peter Sutcliffe, aka the Yorkshire Ripper, numerous times and just said he was nice to everyone, although he was attacked a few times. Her scariest moment for sure, though, involved this huge fat black guy who'd killed animals and eventually a person by sitting on their chests, whilst he'd try his best to watch their faces as they died. Anyway, he was very nice and helpful to everyone, and eventually my ex's mum let her guard down around him. He came with her to get something, and as they went into a room, he closed the door behind him and just stood there. My ex's mum pressed her panic button that all the staff kept with them, and then used her training to try and keep him calm and stall for security, but it was no luck as he attacked her. Luckily for her, though part of her training at Broadmoor also included some self-defense techniques that even the smallest woman could employ. Basically, she used her finger knuckles to press into the sides of his ribs, and he let go of her long enough for her to escape. She did it to me once, and I'll side with the crazy fat black guy on this. It's incredibly painful. Story 18. ED nurse here, but our ED has a specific section for psych emergency, so this counts. The bathroom in this hall is right next to the guard's monitor. They share a wall. The bathroom also has one of those pass-through cabinets you use to give a urine sample at the doctor's office. Like this. Anyway, one day we were dealing with a patient we knew well. Unfortunately, he had multiple complex psych issues, which led to him being with us quite a lot. He was mostly reasonable, but when he got angry, he'd be a handful. Well, one day, one of our docs went in to speak with this patient and somehow made him really angry, and then walked out of the room. The encounter was over as far as the doc was concerned. This led security to have to address this guy's behavior because he became aggressive and began throwing things / shouting, etc. He and the security guard get into it and aren't best of friends, to put it mildly. A few minutes later, he has to go to the bathroom. He walks in and is seemingly behaving himself when he yells, "Surprise!" and throws his feces through this pass-through window straight at the guard. I obviously didn't show any reaction at the time, but I laughed until I cried after I'd walked out. Story 19. Going to go a different route here as all of the stories seem to focus on the shocking and negative/challenging behaviors. I'm not a nurse, but am a support worker. We currently have a patient who, when he was admitted, was extremely aggressive, not physically, and impatient. He was unable to wait for anything for longer than 2 seconds, barely spoke to anybody unless it was on a needs basis, and couldn't do anything for himself. Fast forward 6 weeks, and he has stopped me in my tracks multiple times. The first time he said please when he asked for something. The first time he agreed to make his breakfast himself. The first time he asked how I was when he saw me. And probably the most rewarding of all was when he smiled at me and said good morning. Story 20. Not a nurse, but used to be a police officer. We got called to a psych ward where a guy was smashing up his room. Okay, fair enough. We got there and the room was one where it had plywood-based furniture that was attached to the walls and floor. It had a solid door with an inch-thick safety glass with wire in. He had ripped apart every bit of furniture from the bed with his bare hands, ripped the lights from the ceiling, ripped the sockets out of the walls. This is in the UK, so proper old brick and plaster walls, and smashed a hole in the door window. He had absolutely no weapons in the room and had done all this with his bare hands. I got there, and one of my colleagues was standing outside the door with a shield, and the patient was crashing into the door so hard that plaster dust was falling from the ceiling. He then managed to break through his window that led outside, also an inch thick, and got out onto the roof. They had to talk him down and eventually got him in, and a load of us escorted him to a room filled with only furniture made from foam and padding, and the doctor gave him a powerful sedative and then quickly backed out the door whilst waiting for it to work. They took him to a psychiatric intensive care unit. I'll never forget the amount of damage he did. The room was sprayed with blood and looked like he'd smashed it up with a sledgehammer. He had only used his bare hands and the crappy furniture. That insane thing was he was about 5'6" max and looked about 140 pounds max. He was a small man, but his psychotic break gave him insane superhuman strength. Story 21. Not me, but my mother, who worked at a psychiatric hospital in southern Illinois in the 60s. She was in her 20s at the time and had to wear white and a little white hat while on duty. She had long black hair that she'd let down during her breaks. She was sitting at a table, hair down, smoking a cigarette, as nurses did on breaks in hospitals in the 1960s, when she felt someone running their fingers through her hair behind her. Then she heard a deep male voice say, "Pretty, pretty," as he pulled his fingers through her hair. She realized a patient had somehow made it into the break room. She said she kind of froze, and he spent a few more seconds petting her hair, muttering "pretty, pretty," before someone got him and gently took him back to his room. I know this story because as a child she would come up behind me, run her fingers through my hair, and mutter "pretty, pretty" in a voice that predated Buffalo Bill in Silence of the Lambs.